Hi, I'm Bobbie Jo. Do I have your permission to conduct this verbal interview?
You do.
Okay. And your name, sir?
Robert Evans.
And today is May the 11th. Your address is
2450 West Trailer Court Road, Greencastle, Indiana, 46135.
okay. Are you married or divorced?
Married.
What are you here today for?
I've had an earache.
Which ear?
My left one.
Does it hurt? How would you describe on a scale of 1 to 10 your pain level?
5.
How would you describe it? Aching, sharp, dull?
Probably more of an ache.
When did this start?
That happens every year, so 5-6 years ago. When I get a cold, my ear plugs up.
When did this occurrence actually start?
Mm,
Last week, last month?
a couple months ago.
Did this start at home, or were you away on business, or were you in a foreign country?
I was away on business.
Here in the country?
Yeah, Indiana.
Okay, does anything help?
Holding my nose and blowing helps.
Does anything aggravate it?
Not holding my nose and blowing.
And forgive me for taking notes, but
Oh, that's fine.
I'm just a student, so I'm just trying to...
That's fine. The wind sometimes, the air.
Aggravates it?
Yeah.
Okay, do you have anything else that goes along with it? A headache, jaw pain? Do you have any hearing problems with it?
No, it just feels like I got water in my ear. Fluid rolling around inside my head.
Do you have any allergies?
No.
What are your medications that you're currently taking?
I take propanolol. 40 milligrams once a day.
And what else?
That's it.
And do you use tobacco?
I do.
Of any type?
Yes.
Okay.
I smoke.
How many cigarettes a day? Or how many packs per day?
About a pack a day.
Do you drink or use any drugs?
No drugs. I only drink typically when my wife's at home.
So you drink with her?
Yeah. You can say that.
Your childhood illnesses?
None that I can think of.
You never had chicken pox or...
Yes, I've had chicken pox.
You never had the flu?
Oh, sure.
Do you know about what age you had the chicken pox?
I think I was about 5.
And then, when was the last time you had the flu as far as being a child?
As a child?
Yes.
Oh, I don't remember.
Okay, and your adult illnesses? What's your medical history been?
Overall pretty healthy.
Well, you obviously take propanolol, so you must have had some... Have you had any heart issues associated with that?
Yeah, but a regular heartbeat. arrhythmia or something. I have too much adrenaline or something, they said. So they,
So you also have a fast heartbeat?
yeah.
Okay, have you had any surgeries?
3, actually.
Okay.
I had surgery on my middle finger on my right hand to put it back together from when it was broken.
Okay. And do you know when that was?
I was 17, so long time ago.
Okay. And your other two that you were talking about?
I had a hernia operation, a double hernia. So I had a hernia operation when I was 7.
And your third?
I had surgery on my left foot.
Your foot or ankle?
Foot and ankle.
Was it a repair?
It was plantar fasciitis repair, then a nerve reduction thing, something.
You have... How many children do you have?
3.
Have you taken any psychiatric medications for depression or anxiety? Or any other type of
No.
mental health? What do you do to maintain your health? Do you take a vitamin? Do you exercise?
I don't have any time to exercise because I'm always working. Maintain my health. I don't do much to maintain my health, actually.
You don't watch what you eat? Nothing?
Not really, no.
Okay. Is your father still alive?
He is.
What is his health like?
Not very good.
What condition does he have?
He has heart problems, diabetes.
Is your mom still alive?
Yeah.
Any health issues there?
I think she's diabetic.
How old is she?
59.
And how old is your dad?
70. 73, I believe.
And your children?
What about them?
How old are they? And are they all still alive?
Well, they are. One's almost 4, going on 37. The other is
Girl or boy?
a girl.
Okay.
My oldest son is 26.
And your other son?
He just turned 25.
I just remembered you mentioning that.
Yeah.
Any health problems with any of them?
No,
Okay. Do you have grandparents still living?
I do not.
Where did they pass from?
One from Alzheimer's, one from cancer, and the other from, he died in surgery. He had a lot of problems with his legs, his arteries in his legs, veins, arteries, something. He died of having surgery, cleaning out his veins.
And your other grandmother? . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . .
Oh, my other grandfather. That was my grandmother. One of my grandmothers died from Alzheimer's. My other grandmother died of cancer. My grandfather died of the
surgery with blood clot.
right, and then my father's father was killed in a coal mine explosion.
Do you know approximately what age they were?
My grandfather was when they died.
Mm-hmm.
Oh,
If you don't, that's fine.
70s, 80s.
All of them?
Except for my dad's father, he was probably in his late 20s, early 30s. He died in 1955.
What would you say your interests are or hobbies?
Oh, let's see. Let me think about this for a second. Besides work,
Yes.
fishing and hunting, and spending time with my wife and daughter. Most definitely.
What would you say your support system consists of?
To find support.
Emotional support.
Oh, you're my wife. And my daughter.
How do you cope with things?
My wife tells me what to do.
What would you consider your strengths?
Strengths. I'm a leader, not a follower. I don't listen to very many people typically. I'm a thinker, problem solver.
Exercise and diet?
I don't have much of a diet. I do exercise a little bit.
What do you mean
But I
by
still-
you don't have much of a diet?
I mean, I just,
Do you not eat much, or do you just
I try to eat
eat
well.
on the run a lot?
Yeah, that's probably more like it.
How often would you say you exercise?
Well, I mean, I don't know, a couple times a week probably. But I stay pretty active for work-related stuff, so.
What do you do? Do you wear your safety belt
Safety belt for what?
when you're driving?
My seatbelt?
Mm-hmm.
Oh, yeah.
Do you use any alternative healthcare practices? Incense, aromatherapy?
Yeah, that shit don't work.
How would you describe your financial status?
Well, if I could get my wife to quit making me broke, I'd probably be alright. But other than that, I'm fine.
So you do consider yourself broke?
No. I'm, I suppose, average. If 67 pair of shoes is average, I'm average, I suppose.
How would you consider what do you do for spiritual, if anything? Do you go to church? Do you?
Not very, sometimes, not very often, no. Not really. My wife does, though, so. I try to stand close to her on Sundays when she comes home from church, hoping it rubs off.
Okay. This is the last portion of this, and it may feel like a barrage of questions, but just tell me yes or no if you've had these symptoms.
Okay.
Okay. Have you had any unusual weight loss or gain?
No.
Weakness?
No.
Fatigue?
Sometimes.
Fever?
No.
Any rashes?
No.
Lumps?
Ones that someone gave me or ones that just showed up on their own?
Either.
No.
Sores?
No.
Itching?
No.
Dryness?
My elbows get dry sometimes.
How about any changes in hair color or nails? Any moles you might have?
I got a mole on my arm and it changes every once in a while.
Which arm?
My right arm, forearm.
How do you mean it changes? Does it change color or size?
Yeah, kind of. Yeah, a little bit.
Which?
Both.
What color does it change to?
It just gets a little lighter. Sometimes it gets a little darker.
Have you had any headaches?
Is that? No.
Injuries?
Only emotional.
Dizziness? Or lightheadedness?
No.
Have you had any vision changes lately?
No.
You wear glasses? When was your last exam?
Hell, I don't remember. Probably, yeah, I probably need to go to the eye doctor again. Probably 2 years. Let's just say 2 years.
Pain or redness or excessive tearing?
And what?
Your eyes.
Oh, no.
Have you been seeing doubled or having any blurred vision?
No.
Seeing spots or specks? Flashing lights?
Nope.
Pressure behind your eyes?
Nope.
Cataracts?
Nope.
Okay. This pertains to your ears. Have you had any hearing changes?
No. Selective.
Ringing in your ears?
Rain? No.
Yeah.
No.
Vertigo? Which is like dizziness.
With when I
balance.
have my earaches, yeah.
So you're having some now? Are you experiencing?
Not at the moment. I have in the past few weeks though. Before I got some medicine.
Have you? And you are having an earache now? Are you having any discharge?
No.
Okay. And you don't use hearing aids?
No.
Okay. What about frequent colds?
I don't know, not really. Average, maybe couple of years, and usually spring and fall. Sometimes maybe an early summer one. Cold.
Any nasal stiffness or discharge?
No, right now, no.
Itching, hay fever, nosebleed, sinus trouble?
No, not really.
Okay, this pertains to your throat and your mouth. Have you had any teeth or gum problems?
Just basic teeth problems, like everybody has, I guess. But other than that, nothing.
Bleeding gums?
Not that I can recall.
When was your last dental exam?
6 months ago, 8 months ago.
Sore tongue, dry mouth, frequent sore throats?
No, I get a sore throat once in a while.
Hoarseness?
Once in a while.
Okay, and this pertains to your neck. Any swollen glands?
None that I'm aware of.
Have you ever been told you have a goiter?
A who?
A goiter?
I don't know what that is.
It's like a lump on your neck.
No.
Pain, stiffness in your neck?
Yeah, sometimes.
How would you describe that pain?
Dull
And timing? When does it happen?
It typically happens when I wake up in the morning.
Okay.
Would you like to know why?
Why?
Because typically I'm given very small portion of the bed to sleep on. So I'm forced to hold myself up all night long.
Oh, that sounds so uncomfortable.
It most certainly is.
Your chest area, have you had any lumps or pain or discomfort?
No.
Okay. Any cough or sputum?
I cough on occasion, yeah.
What's on occasion?
Every
day, every other day?
Probably, I just normal cough every day, every other day, nothing too extraordinary.
Have you had any nosebleeds or coughing up blood?
No.
Shortness of breath?
Only when I exercise.
Does it make you have to quit exercising?
No.
Wheezing?
Sometimes.
When does that occur?
Typically if I have a cold.
Any pain with deep breath?
No.
Last chest x-ray?
Last chest. 6 months ago, 8 months ago. Something like that.
What did you have that in relation to?
That's a good question. When did I have a chest x-ray? I had it for... I want to say I had a respiratory infection, I want to say.
Asthma, bronchitis,
Nope,
emphysema?
not yet.
Have you ever been told you have pneumonia or tuberculosis?
No.
Okay, you already said you have some heart trouble, hypertension. Have you ever had a rheumatic fever?
I don't know who she is.
You would have known. Have you ever been told you have a murmur? Heart murmur?
No.
Chest pain, discomfort?
Ever or now?
Ever?
No, sure.
Do you ever feel like your heart is going to pound out of your chest?
Every day when I see my wife.
Do you ever feel like you have to sit up at night in order to be able to breathe? Like leaned up against pillows?
No.
Do you ever feel better sitting up to breathe than laying down?
No.
Do you have any swelling in your hands or feet?
Oh, my hands I think swell up sometimes.
And have you had an electrocardiogram where they hook you up to a bunch of wires?
Oh, yeah.
What do you know what the results of, or do you remember?
No. It usually says the same thing, some kind of afibrillation thing or something, I don't know.
Have you had any other cardio tests, stress test, or?
Yeah, I've had a heart stress test, usually every 3 or 4 years. I have one.
Do you know what the last one said on it?
Stop smoking, have a better diet,
Okay.
that kind of stuff.
Do you ever have any trouble swallowing?
No. I did one time.
Was this in relation to your heart issue?
No.
How long ago was that?
Oh, probably about 8 years ago.
Related to stress?
I don't know.
Came on suddenly?
Yep. Come on suddenly where couldn't swallow for seemed like weeks, months.
Do you have heartburn?
I take heartburn medicine, but yes, I do have heartburn.
What heartburn medicine do you take?
Oh, I forgot. You asked me that earlier. Ranitidine. 300 milligrams.
Once daily?
Once daily.
Have you had any appetite changes?
No.
Nausea?
No.
Any changes to your bowel movements?
No.
No. Okay. Do you have any pain with defecation?
No.
Rectal bleeding?
None that I'm aware of.
Black tarry stools?
No.
Constipation or diarrhea?
No.
Abdominal pain?
No.
Would you say you're intolerant to any certain foods?
I don't like spinach. It's kind of disgusting to think about, actually.
Have you had any excessive belching or flatulence?
No.
Jaundice, liver?
No. I get my blood drawn, though, every 90 days because the medicine I take can affect my liver. Or something, I think.
Hepatitis?
No.
Gallbladder trouble?
No.
Okay. Do you ever have intermittent leg pain?
No.
Leg cramps?
Sometimes, maybe.
Varicose veins?
No.
Any past clots?
No.
Swelling in calves? Feet?
No.
Color changes to your fingertips or toes when it's cold outside?
If I stay outside too long with no gloves on, my hands get blue.
Swelling with redness or tenderness?
Where?
Hands, feet.
Oh. No, I mean, if they swell up a little bit sometimes, but no, not, I'd say no.
Okay, this is in relation to your urinary system. Any frequency of urination? Like, do you have to go a lot?
I mean, if you're asking if I'm one of them people that have to get up in the middle of the night and go pee, the answer is no.
Okay, do you have any burning or pain when you pee?
No.
No blood? No urinary tract infections?
No.
Okay, do you have any kidney or flank pain?
Every once in a while I probably have kidney pains because my wife says I don't drink enough water.
Have you ever had kidney stones?
No.
Any pain just directly below your
No kidney stones.
needle, your belly button?
Pain?
Yeah.
No.
Have you ever had incontinence? Where you just pee automatically and don't
negative.
realize?
No.
Okay. Do you ever feel like you have a decreased force of your urinary stream?
Sometimes.
Hesitancy or dribbling?
No.
Okay. And you said you'd had a hernia in the past. Do you have any discharge or sores?
No.
Masses? Any pain with your scrotum?
Nope.
Swelling, history of STIs or sexually transmitted infections?
No.
Okay. In the past, have you been pretty safe as far as when you've had?
Sure. That's why I got a 3-year-old.
What do you use currently for birth control?
I don't.
And have you ever had a fear of HIV?
No. I never was one to get around much.
So you've been pretty monogamous in relationships?
Yeah. All of them.
All with women?
Absolutely. God love them.
Okay, this is pertaining to your muscle. Joint pain or muscle pain?
Yeah.
All the time? Just sometimes?
It just depends. I get a pain in my ass on occasion. mostly related to my wife. But other than that, my right elbow's actually killing me lately. I don't know.
When did that start?
When I was at the law enforcement academy.
How long ago was that?
February, March. It's my right elbow. It almost feels like the tissue's gone. I'm not sure if it was.
Does it get stiff?
No. It just hurts like inside the joint, like inside the bone.
Have you ever been told you have arthritis?
No.
Gout?
No.
Any backache?
Not really, no.
Do you notice any swelling or redness at your elbow?
No.
Is it tender?
Yes.
But you said it wasn't stiff or weak.
It is a little weak when it starts to hurt. If I go to move something, it hurts bad enough that it does. Sometimes.
Has it limited your activity?
Yeah, it can.
How?
Because it hurts. So when I go to do something with it, it can cause me not to be able to do it because of the
With
pain.
motion or leaning on it?
Leaning doesn't bother it. It's typically almost like counterbalance weight. Weight will cause it to hurt. If I pick something heavy up and go to articulate my arm and more sideways than up and down. But
How often does that occur?
Usually when I pick up anything heavy.
So is that every day?
It can be. It's not every day, but it's actually sore to the touch if you stick your finger in the joint.
Any trauma history?
Trauma.
A wreck or
Yeah, lots of them.
a fight?
Mm-hmm.
How many wrecks have you been in?
Car wrecks?
Yes.
Let's think about this for a second. That's 1, 2, 3. Does hitting a deer at 100 mile an hour in a police car count?
Yes.
4. 4.
Any fights?
Yeah.
Several or just
Well,
countless?
my line of work, it's a common occurrence, unfortunately.
Okay, would you say you have any neck or lower back pain?
On occasion, lower back pain maybe, but usually I'm pretty fortunate on the back pain.
The elbow pain, you haven't experienced any fever or chills,
No,
weight loss or otherwise?
no.
Okay, do you ever have nervousness,
Oh yeah, constantly.
tension,
Absolutely.
mood changes,
So my wife says.
any history of depression,
No, not really, no.
memory problems?
Yeah. So my wife says.
Any suicidal? She sounds like quite a woman. Maybe one of these days I'll have to meet her.
Yeah.
Suicidal ideation.
Good luck. No, absolutely not.
Okay. Any past counseling or psychotherapy?
Only from my wife.
Have you ever been admitted to the hospital for psychiatric?
No.
Okay. This is. Have you had any attention or speech changes? Like attention span?
No.
Orientation problems?
No.
Judgment?
No.
Dizziness? Vertigo?
Only related to my ear.
Fainting or blackouts?
No.
Paralysis, numbness, or loss of sensation?
Just in my foot from where I had that surgery.
Pins and needles or a tingling feeling?
No, not really.
Tremors or other involuntary movements?
I
Any
do.
seizures?
I do have tremors.
Where at? In your arms?
Hands. arms, yeah.
Is this all the time?
Yeah, pretty much.
How long has that been going on?
Oh, always had a little bit of them since I was a kid, but they got worse when I had my heart problems, so probably 15 years ago.
Have you ever been told you have anemia? It's a low blood iron.
Once, yes, once.
When was that?
Well, oh my gosh, maybe 8, 9 years ago.
Easy bruising?
Do I bruise easy?
Mhm.
Yeah.
Bleeding past blood transfusions?
No blood transfusions.
Do you bleed from your gums or anything, like when you go for dental work?
No. Well, yeah, when I go for dental work, yeah.
Okay. Have you ever had any thyroid trouble?
Not that I'm aware of.
Heat or cold intolerance?
Yeah, I don't like to be too hot, and I don't like to be too cold.
But it's never been excessive?
No.
Okay. Any excessive sweating or thirst or hunger?
No.
And have you recently had a change in your glove or shoe size?
No.
Okay. Thank you very much for the opportunity to have this conversation with you, and I will see you next time.
All right. Thank you very much.
Thank you.